So let's talk about Christmas and the 5 day relaxation period over Christmas that the government announced a while ago, and sort of the kind of health medical professionals saying that this isn't a good idea, and their kind of reasoning behind that. So loosening COVID restrictions across the UK over Christmas is a mistake, a public health expert has said. Edinburgh University's Professor Linda Bald said there was concern about people travelling from high to low prevalence areas to see their loved ones. Wales Health Minister Vaughan Gathing said changes would cause huge issues about trust, but could happen if the rates stayed high. So, he's, the health minister of Wales saying that if they did change anything now, if they changed the announcement from the 5 day visiting thing where you can see your relatives, um, like one set of relatives basically, if they change that, there would be huge trust issues. I don't think that would be the case. I think that people would see, you'd have to explain to people that the change in the data that's happened. Had the UK been more active when it came to the lockdown and done it earlier, we might not be in this situation. But at the same time, if the lockdown continued up until around Christmas, you gave people 5 days just to go see people, you're going to see a massive spike in cases. But we've already seen that massive spike in cases happen now. So chances are that doing this, when we look at the numbers, it's going to be a very stupid idea. So up to three households can stay together and form a Christmas bubble from the 23rd to the 27th of December, as agreed by all four UK nations. Professor Ball told BBC Breakfast that from a public health perspective, I have to be perfectly honest. I think this is a mistake, and I think people, even though we're permitted to do this, I think people have to think very carefully whether they can see their loved ones outside or do it in a very, very modest way. And so the point being is here, we can see what how people in this country are going to react, because now we've been given the freedom to make our own decision here. And if the COVID levels go up massively, the government will blame the public for this. Mr. Gathing said, or they'll say, we all got very complacent. Mr. Gathing said he would not rule out another lockdown if cases continued to rise, echoing a warning made by First Minister Mark Drakeford. That's a cool name, Drakeford. He added, but the agreement around Christmas period isn't just a political settlement. It really is, because we understand what sort of shape to that period of time. We might see people make up their own rules with a real potential of even greater harm. I mean, you're allowing three households to form a bubble. I mean, how many households do you expect people to bring around? 7, 8, 9? Like, I don't understand. The point being here is, this public health official saying it's a big mistake. We have relaxing COVID restrictions could trigger a third wave. NHS bosses warn. I know where I live, the chance Northampton could go into tier 3 from tier 2, which would be dreadful, to be honest. So relaxing COVID measures, COVID restrictions could trigger a third wave of the virus during the busiest time of the year for hospitals. We know that the NHS always struggles during the winter, especially under the last 10 years under Conservative rule. Obviously, when you throw in the pandemic into it, it makes things much worse. So the government said it will not hesitate to take necessary actions to protect local communities. Decisions on tiers are made by ministers based on the latest data available. So these are political decisions based allegedly around the science. I don't believe that, because we know that London should have gone into tier 3 but didn't because of economic and political reasons. Chris Hobson, chief executive of NHS providers, told the BBC, we're about to hit our busiest time of the year, so people are really worried that if we relax the restrictions now, the NHS simply won't be able to cope with that all that work that it needs to do in late December, January and February. He told BBC Breakfast that the NHS currently has 10,000 fewer beds than last winter because of COVID, meaning beds must be socially distanced. At the same time, you've got rising infections in places like London, Essex and parts of Kent, parts of Lincolnshire. So he's saying here that if we do this, if we allow the relaxation, the NHS is going to be absolutely overwhelmed. The letter warned of significant pressure on hospital beds, with 13,000 patients in hospital with COVID-19 on Thursday, compared with 500 at the beginning of September. Over each of the last 5 winters, demand for NHS beds has significantly outstripped capacity, it said. And so what that means is, with this combined with COVID coming in, we're going to see massive amounts of problems, and people having to maybe go further distance to be seen, or people that if you're not at risk of death, you may not be seen at all. And you can say that's me scaremongering here, maybe I'm a bit, But that seems to be the case. COVID public must think carefully about Christmas risk. NHS bosses warn. People must think really carefully about the risk of more social contact over Christmas. NHS bosses have warned. I don't want to be the Grinch who stole Christmas, says Chris Hobson, the head of NHS providers. But he pointed out that the US saw record numbers of cases and deaths after Thanksgiving holiday. He said the NHS was worried about January. The government's Dominic Raab said people needed the 5-day relaxation of COVID rules on an emotional level. But the thing is, Rob, if you go out and you go see your family members and you catch COVID, or worse, you give one of your family members COVID and they die, or they're hospitalized, how great are you going to feel about that? What's your emotional state going to be then? Between the 23rd and 27th of December, coronavirus restrictions are being relaxed across the UK, allowing 3 households to form a bubble and mix indoors and stay overnight. But NHS providers, which represent hospital trust in England, have written to the Prime Minister urging him to personally lead a better public debate about the risks inherently in the guidance, although it stopped short of calling for a review of the rules around over Christmas. And so the NHS is not trying to get too involved in the politics here, but kind of has to, because if hospitals are overwhelmed, you're going to see massive problems within for staff and also for beds. We've already talked about how high how damaged the mental health of healthcare workers is, such as nurses and doctors. We've talked about how high suicide rates are among nurses, because they simply can't deal with the stress of the situation. We talked about how hospitals were understaffed already pre-COVID, and now it's far worse. So third wave risk. NHS providers also warned that relaxing COVID rules when they are reviewed in England could trigger a third wave of the virus during the busiest time of the year, something we mentioned. And here you've got the different tier lists. So you've got medium, high and very high. And so if we actually look at the numbers here, we're on par with Germany. So it's going to be very interesting to see what Germany do, considering that we're pretty much level with them when it comes to the per capita numbers. And what we can see here is that at the moment the cases are around 25.5 average cases per 100,000 people, and we can see that the lockdown happened, announced it was in November, I think, start of November we went into lockdown, and so if we look at the numbers in November, we can see that the numbers were around 34.5 cases per 100,000. We can see here now we're at 25.5 average cases per 100,000, and so if those numbers do climb back up by Christmas, Christmas is in what? This video shot on the 13th. It won't be out till later next week because of scheduling. But what we can see here is that those numbers could easily climb. So if we actually look at, November 1st is when we went into lockdown, 34.5 cases. So if we look at the week before, we were at about 31. So cases can rise by about 7 per 100,000. And so if that happens here, we'll be hitting, 30, about 33 cases per 100,000 people. And that's around the numbers that the country went into lockdown initially. So if we think about in about a couple of weeks' time how high the numbers are going to be, what we can tell from this is we're going to be around the original lockdown numbers. We're going to be around the second lockdown numbers. And so in January, it's going to be very likely that we're going to see another national lockdown, especially if we make this decision around Christmas. So, obviously the government's saying be responsible. NHS workers are saying, it's ain't a good idea, dog, without, fully saying it. I'm not going to tell you what to do or not to do. You do what you think is the right choice. But then the country has to live with the consequences of it. So let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I will see you in the next one.